Hello, I'm Laura Jost with the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. President Obama has signed the 21st Century Cures Act into law, which will put $1.8 billion into the Cancer Moonshot program over the next 10 years. The act streamlines the FDA approval process for new drugs and medical products, which drew some criticism from patient advocacy groups. It provides a total of $6.3 billion for initiatives that include mental health research and $1 billion over the next 2 years to treat heroin and opioid abuse. Vice President Joe Biden played a large role in the bill's passage after his son, former Delaware Attorney General Beau Biden, died of brain cancer in 2015. Said Biden, "Without the true bipartisan support, this piece of legislation would have never occurred, and it's going to help millions of people. The 21st Century Cures Act is going to harness America's best minds of science, medicine, and technology to tackle some of our biggest and most complex health challenges of today." Opioid abuse in the United States is so rampant that it's driving down life expectancy. That's what the CDC reported last week when it released data that showed the expected lifespan for an American dropped 1/10 of a year between 2014 and 2015. While deaths from cancer are declining, death rates from accidents, including overdoses, are rising quickly, and prescription opioids and heroin are to blame. The last time life expectancy dropped was 1993. For AJMC's new guideline on opioid management, visit ajmc.com. AJMC last week covered the first meeting of the National Center for Complex Health and Social Needs, which will build on the work of the Camden Coalition for Healthcare Providers and bring together a national network of healthcare leaders with expertise in treating patients with multiple medical and mental health issues. AJMC spoke with Dr. Jeffrey Brenner about the challenges of paying for treatment for this population.
Tremendous funding challenges to care for these patients, building programs. So there are no obvious funding sources out there right now. So the typical Medicare fee schedule, the way Medicaid is structured, the way commercial insurance is structured, doesn't provide the flexibility and the team-based structures that you need to care for these patients. So, lots of folks end up with either separate hospital funding, grant funding, or even pilot funding through a contracted relationship with an insurance company. But those aren't sustainable. They will get you started, but they're certainly not going to keep you in the game.
CVS Health will offer a new service, Transform Diabetes Care, to its pharmacy benefits management clients in 2017. The service is designed to use data analytics to identify opportunities to boost medication adherence or better lifestyle management through visits to its pharmacists or Minute Clinic staff. CVS estimates it can save clients $3,000 to $5,000 per year for each person with diabetes through medication cost control and other savings. CVS has been aggressive in keeping higher cost drugs off its formulary. Earlier this year, CVS Health announced it would drop the popular insulin Lantus in favor of the biosimilar Basaglar starting in January. The new issue of Evidence-Based Diabetes Management takes a look at how payers fund diabetes self-management education and how evidence shows more frequent education would be cost-effective. The new issue, published in partnership with the American Association of Diabetes Educators, features coverage from the group's conference and a joint commentary from AADE President Hope Warshaw and EBDM Editor-in-Chief Dr. Robert Gabbay, who is Chief Medical Officer at the Joslin Diabetes Center. For the full issue, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.